Welcome back to Iron's Health Talk with Dr. Akram. Today we are discussing about coronavirus. In the beginning of the show, we discussed about different pandemics which affected the world. Then we mostly talked about the existing problem, the COVID-19, and its spread. Probably it's time to discuss about few queries raised from families and friends. And first question is how long the coronavirus can live outside. Basically, I have been searching the literature, and they haven't done probably any studies on this particular virus, but mostly coronaviruses could live in lower temperature, which is like less than 27 degrees for up to 9 days. In high temperature, if the temperature is above 27 degrees, they possibly live about it's about 24 to 36 hours. And wearing face mask. In the beginning, when the coronavirus started, the face masks being sold for highly expensive price, and then the government institutions had looked into it, and they realized wearing face mask, if you do not have the disease, will not help you much. But if you have coronavirus and if you are coughing, it will help to prevent the disease going to others. But on the other occasion, healthcare workers, when they are dealing with patients who are close to them, then they should wear face masks. And the other question was like, will antibiotics help this disease? Of course not, because this is a viral disease and virus does not respond to antibiotics. And giving paracetamol. We always advise people to take paracetamol. If you have fever or body pain or anything like that, then ibuprofen. Ibuprofen, there have been some studies which is done in Italy, and they have realized when people took ibuprofen, the disease was more severe, and I'm not sure if that made them to die, but it's better to avoid ibuprofen. Smoking. Smoking is not a good idea anytime, but especially with this disease, if you're going to get a pneumonia and if you've been smoking, you have a high chance of dying. So stop smoking will be my advice at this time. The other question was from someone who received a letter from China, and he was kind of frightened to open, and he sent me a message, I received a parcel from China, can I open it? It's high likely you will not get an infection from a letter which comes from China, because it's been traveling through the post for a while, and it's quite unlikely the virus lives in it. And will heat kill the virus? Basically, any organism will be killed with high heat, but if you cook the food and you eat it, the virus won't be alive there. There was a friend of mine who is a taxi driver. He called me one of the afternoons, and he asked me, he said, I had cough, sore throat yesterday, but I feel fine today. Can I drive my taxi? My advice would be is like any symptoms like coronavirus, if you suspect coronavirus, you should be careful, because it's not only you could give the infection to the others. So my advice would be, please, if you have infection, don't drive your taxi or don't go around and spreading the infection to other people. There is another young friend of mine who loves to go to gym, and he is fit. And he said, I had mild fever, runny nose yesterday, but today I feel fine. Can I go to the gym? My advice would be like, if you have a viral illness, your body is fighting really hard to get rid of that illness. At that point, even if it's not coronavirus, you go to the gym, you put your body in stress and your immune system comes down. That's not a good idea. So even if you do not have coronavirus, please don't go to the gym if you have fever and flu-like symptoms. But especially when the coronavirus is spreading around, you should avoid common places, public places, gym, exercise. But exercise is a good idea. I would advise anyone to do it anytime, but not when you have a flu. If I have a flu-like symptoms, what should I do? The NHS England and World Health Organization has made a lot of guidelines. Please follow the guidelines. And this is the best thing you could do is basically what we would say, if you live alone, you should self-isolate yourself for 7 days. But if you live with your family should be self-isolating themselves for 14 days. I think this is the simplest explanation for that. Today I received 2 more questions just before the show from my family because I think it's Mother's Day or something, and they have seen a lot of flowers being delivered to these elderly mothers who've been living alone. Giving flowers is one of the best things, and women likes it. And I would say you should give flowers. But at this time when the infection's going on, there is a possibility these viruses can live in these flowers because the medium is cold and there is a best place for them to live. And a lot of people handle these flowers. Is people who pick it and the people in the shop and you yourself carrying in your hand. What I would say, yes, if you want to give flowers, but please use gloves or ask them to take the flowers, put it in a vase and go straight away, wash their hands and don't touch the flowers. The last one is, well, every public place is closed. So parks are full of people and they ask me, what is your opinion? I would say, I can't ask people to just stick to their home, but you could go to the park if there are not many people, you could walk around and get some fresh air. But if the parks are full of people, please avoid that place. And especially when you're sitting down on those benches and chairs, just don't touch anything. Or if you touch anything, use alcohol wipes and clean your hands and just be careful. And I think this is time to wrap up our show. I thank you all for watching our show, and I hope to see you next time in a more exciting program with my invitees, and we will be talking more about coronaviruses and other illnesses. Please stay tuned. ION's Health Talk with Dr. Akram. See you next time.